Which chamber of the heart has the thickest wall? Correct option is B. Left ventricle. Which valve prevents backflow of blood into the right atrium? Correct option is C. Tricuspid valve. Which vessel supply oxygenated blood to the heart muscle? Correct option is B. Coronary arteries. The SA node normally generates impulses at what rate? Correct option is C. 60 to 100. Which vein brings deoxygenated blood from the upper body to the heart? Correct option is C. Superior vena cava. The pacemaker of the heart is located in which chamber? Correct option is A. Right atrium. Chordae tendineae function 2. Correct option is B. Prevent atrioventricular valve prolapse. The mitral valve is also known as. Correct option is B. Left AV valve. The bundle of hairs is located in the. Correct option is B. Interventricular septum. Which nerve decrease heart rate when stimulated? Correct option is A. Vagus nerve. Which ion initiate depolarization in cardiac muscle? Correct option is B. Sodium. During systole, which valve remain closed? Correct option is A. AV valves. Which ECG wave represent arterial depolarization? Correct option is A. P wave. What percentage of cardiac output goes to coronary circulation? Correct option is C. 5%. Which heart layer is responsible for contraction? Correct option is B. Myocardium. Average stroke volume in adult is. Correct option is B. 70 ml. And fetal circulation. The foramen oval connect. Correct option is B. Right atrium to left atrium. Which hormone increase heart rate? Correct option is B. Epinephrine. Closure of AV valve produce which heart sound? Correct option is A. S1. Cardiac output is equal to stroke volume multiplied by. Correct option is B. Heart rate. Later phase of action potential is due to entry of. Correct option is C. Calcium. Which chamber receive blood from pulmonary veins? Correct option is C. Left atrium. Which valve prevent backflow into the right ventricle? Correct option is B. Pulmonary valve. Normal ejection fraction is. Correct option is C. 55 to 70. Coronary fibers distribute impulses to. Correct option is B. Ventricular muscle. The Frank-Starling law relates stroke volume to. Correct option is A. Preload. Which artery supply most of interventricular septum? Correct option is B. Left anterior descending artery. Ventricular relaxation corresponds to. Correct option is B. Diastole. Sympathetic stimulation releases. Correct option is C. Norepinephrine. Which layer is also called the epicardium? Correct option is C. Visceral pericardium. Which chamber pumps blood to the pulmonary artery? Correct option is A. Right ventricle. Oxygen saturation in left atrium blood is. Correct option is C. 98%. Which valve prevents regurgitation into left ventricle? Correct option is A. Aortic valve. Duration of cardiac cycle at rest is. Correct option is C. 0.8 seconds. Potassium imbalance may lead to. Correct option is B. Arrhythmias. Closure of semilunar valve produce. Correct option is B. S2. Which vein ran into right atrium via coronary sinus? Correct option is B. Great cardiac vein. Which fetal structure become ligamentum arteriosum? Correct option is B. Ductus arteriosus. Ability of cardiac muscle to contract without nerve import is called. Correct option is C. Autorhythmicity. The coronary sinus open into which chamber? Correct option is A. Right atrium.